Now NBC5 responds. An estimated 41% of Americans are carrying some kind of medical debt, according to a report from the Kaiser Family Foundation. Surprise bills for out-of-network services are one of the biggest causes of that debt.
Well, tonight our PJ Randhawa shares how one out-of-network ambulance ride left a Glenview family with a nearly $9,000 bill, and what you can do to make sure that this doesn't happen to you.
When Wayne Kaplan's 17-year-old son Charles began having chest pains this summer, he took it seriously.
We decided to take him to the emergency room at Glenbrook Hospital.
Wayne says Glenbrook Hospital staff told the family Charles had to go to a nearby pediatric ICU for more testing.
They told my wife and I that they needed to order an ambulance and have him transported to Lutheran General Hospital.
Hours passed as they waited for the ambulance. Once it arrived, the ride only took about 10 minutes. Charles was released after a few hours with a clean bill of health.
What did you come to find out about that ambulance ride?
Well, the result of that is shocking. We got a bill in August that totaled over $8,600.
On his bill, Wayne saw Superior Ambulance charge $60 per mile for 5 miles with a base rate of $7,850. The company classified the ride as an emergency. Wayne thought that was odd.
The ambulance took about 3 hours to come.
His insurance company only covered about half of the bill because Superior Ambulance was out of network, something Wayne didn't even think to ask about.
I think the hospital obviously should have some culpability in these things. They had my insurance. They're the ones that called the ambulance.
In a statement, a Glenbrook Hospital spokesperson told us they're unable to discuss the details of individual cases due to privacy laws, but they prioritize the well-being and medical needs of their patients when making transportation decisions.
Around 70% of ambulance interactions will result in a surprise bill here in Illinois, and the average out-of-pocket cost is over $500.
Abe Scar with the nonprofit consumer protection group PERG says ambulance companies often have a blank check when it comes to what they can charge.
A lot of these costs are not based in reality. They're based on the opportunity that exists in our fractured system for private actors to extract excessive profits.
Earlier this year, the Better Business Bureau issued a warning about Superior Ambulance, stating they've received a pattern of complaints about excessive transport fees. The company did not respond to the BBB, but in a statement, Superior Ambulance told NBC5 Responds they're unaware of them being in poor standing with the BBB. They perform over 400,000 patient transports annually, and they say Superior works with each family/patient in resolving billing issues. They could not provide specific comment on the Kaplan's case. NBC5 Responds found Illinois is one of a handful of states that does have protection for surprise ambulance billing, but the scope is limited.
It only covers state-regulated plans, not employer self-funded plans, which is about 60% of folks are covered under those employer self-funded plans.
That doesn't help Wayne, but he was able to get his bill down by simply negotiating with Superior Ambulance.
They offered to reduce the bill by a little more than 30%, which was substantial. I'm sure that people get financially ruined by situations like this. It's terrible.
That may be the biggest takeaway from this story. Experts say you should try to negotiate with the ambulance company yourself to get your bill down. Also, don't depend on your hospital or medical provider to tell you if they're using out-of-network services. If you're able, always ask. PJ Randhawa, NBC5 Responds.